Hello, today we will be discussing about the hip bone. So this is the hip bone. There are two hip bones, the right and the left. Both of these along with the sacrum and the coccyx constitute the bony pelvis. So talking about the hip bone is made up of three bones actually, the ilium, ischium and pubis. The three in the early stages of life were connected by a Y-shaped cartilage, and then later it ossifies in the acetabulum. Acetabulum is the lateral cavity present on the hip bone and it articulates with the head of the femur. Now, talking about each bone individually. This is the ilium. Ilium is the large expandable bone above the acetabulum. So, it has two ends, three surfaces and three borders. Talking about the ends, it has an upper end and a lower end, three borders, an anterior border, posterior border and medial border. Then comes to the surfaces, the iliac fossa, the gluteal surface and the sacropelvic surface. So, talking about each of them individually. First, talking about the ends. It has two ends, the upper end and the lower end. This is the upper end. Upper end is also known as the iliac crest. It forms the upper border of the ilium. So, in the horizontal position, you can see that the ilium is concave anteriorly and then convex posteriorly. Now, next, talking about the upper end, it is divided into a ventral 2/3 and a dorsal 1/3. In the ventral 2/3, it has two lips, an inner lip and an outer lip. In between, you have the intermediate segment. So, the iliac crest has two bony prominences. In the anterior-most portion, you have the anterior superior iliac spine, and in the posterior-most portion, you have the posterior superior iliac spine. Now, talking about the ventral 2/3. Here, behind the anterior superior iliac spine, almost 5 cm behind, you have the tubercle of the iliac crest. This is the tubercle of the iliac crest. Now, talking about the dorsal segment. This is the dorsal segment. Similarly, it also has an inner lip, outer lip and intermediate ridge. Okay, so next, talking about the lower end. This is the lower end. The upper part of the acetabulum is known as the lower end of the ilium. Next, talking about the borders of the ilium. It has three borders, an anterior, posterior and medial border. First, we talk about the anterior border. This is the anterior border. Starting from the anterior superior iliac spine till the acetabulum is the anterior border. So, here in between the acetabulum and the anterior superior iliac spine, you can see another projection. This is the anterior inferior iliac spine. Now, here just below the anterior superior iliac spine, you can see a notch. That is where the lateral cutaneous nerve passes. Next, talking about the posterior border. This is the posterior border. Starting from the posterior superior iliac spine, it continues with the posterior border of the ischium. So, what are the presenting parts in the border? So, you have the posterior inferior iliac spine, the greater sciatic notch, ischial spine and the lesser sciatic notch. So, posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch, ischial spine, lesser sciatic notch. These are the parts in the posterior border. Now, talking about the medial border. This is the medial border. Starting from the inner lip of the iliac crest, you go down till the iliopubic eminence. This is the medial border. Now, the lower part of the medial border is smooth, and this is known as the arcuate line. The medial border separates the iliac fossa from the sacropelvic surface. Okay, now talking about the surfaces. Talking about the surfaces, there are three surfaces: the gluteal surface, iliac fossa, and sacropelvic surface. First, we talk about the gluteal surface. It is named so because all the gluteus muscles originate from this region. Okay, so there are three lines actually, the posterior, inferior and anterior gluteal lines. So the three gluteal lines, first you have the posterior gluteal line. This is the shortest gluteal line, starting from the upper border of the greater sciatic notch till the iliac crest. This is the posterior gluteal line. Then comes the longest gluteal line, the inferior gluteal line. The inferior gluteal line starts from the middle portion of the greater sciatic notch and then it goes till the iliac crest. And then comes the anterior gluteal line. This is from just below the anterior inferior iliac spine to the upper end of the greater sciatic notch. So, the three gluteus muscles, maximus, medius and minimus, originates from here. Just behind or posterior to the posterior gluteal line, the gluteus maximus originates. And then in between the posterior gluteal line and the inferior gluteal line, the gluteus medius originates. In between the anterior gluteal line and the inferior gluteal line, the gluteus minimus originates. Now, next coming to the iliac fossa. This is the next surface. Now, the iliac fossa is a very smooth and shallow fossa present anteriorly. Now, you have a nutrient foramen right over here in the postero-inferiorly in the iliac fossa. You can see the nutrient foramen. The nutrient artery arises from the iliolumbar artery. So, this is the sacropelvic part. It is divided into two, the sacral part and the pelvic part. Talking about the sacral part, you have the iliac tuberosity over here. Then you have the auricular surface. It is named so because it is in the shape of a pinna. This articulates with the sacral, with the auricular surface of the sacrum. And then comes the pelvic part. This is a smooth surface. So these are the three surfaces. Next, talking about the pubis. It is the anteriormost bone of the pelvic bone. So this is the pubis. It has three parts: the body, the superior ramus, and the inferior ramus. First, talking about the body. It has an anterior surface facing anteriorly, a posterior surface facing posteriorly, and then you have the symphyseal surface. The symphyseal surface articulates with the symphyseal surface of the next bone, and it forms the symphysis pubis. Next comes the features of the body. Now, you have the pubic crest over here, and then you have the pubic tubercle. Now, overlying the pubic tubercle is the spermatic cord and the round ligament of uterus in males and females. Now, talking about the superior ramus. The superior ramus has three borders. First, from the pubic tubercle till the arcuate line of the ilium comes the pectineal line. Then, you get the obturator line. This is the obturator line. This is the obturator foramen, and then you get the obturator line. Now, inferiorly, that is here, you get the inferior border. Now, these are the three borders of the superior ramus. Now, just below or behind the the inferior border and the obturator foramen, you get a notch. This is the notch. Now, this notch is converted into a canal by the obturator membrane and the muscles. So, that is where the obturator nerves and vessels pass. Now, next, talking about the inferior ramus. This is the inferior ramus. It connects the pubis with the ischium. So, it's also known as the ischiopubic ramus. This is the ischium. Talking about the ischium, it has a body and a ramus. This is the body. This entire surface is the body of the ischium, and then you have the ischiopubic ramus. Now, talking about the surfaces of the body of ischium. First, it has a pelvic surface. This is the pelvic surface. Then here, you have the femoral surface, and dorsally, you have the dorsal surface. Now, the next part we have to identify is the ischial tuberosity. This entire thing is the ischial tuberosity. It has an upper quadrilateral portion and a lower triangular portion. The ischial tuberosity is where the hamstring muscles attach. That is, the long head of biceps femoris, semitendinosus, semimembranosus all attached to the ischial tuberosity. Next, talking about the acetabulum. The acetabulum is a deep hollow in the lateral surface of the hip bone. It faces laterally and forward. Okay, so next, parts of the acetabulum. At first, you have the acetabular notch. This is a gap in the acetabulum. Then inside, you get the acetabular fossa, which is a rough area in the middle. This is non-articular and it is filled with a pad of fat. Next, this is the horseshoe-shaped acetabular notch or the lunate surface. This is where the head of the femur articulates. Next, we talk about the obturator foramen. Obturator foramen is a large hollow in the pelvic bone. It is bounded by the pubis and ischium below and the acetabulum above. Now, it is large and oval in males and it is small and triangular in females. It is covered by the obturator membrane. It covers a whole of it. It covers the entire foramen except for the obturator canal where the obturator nerves and vessels pass. So next, the most important, side determination. So for side determination, the ilium is expanded and it should face upward. And then the pubis, it should face medially and forward with the symphyseal surface projecting medially. Then the acetabulum should face laterally, forward and downward. So this is the left pelvis. Make sure that the ilium faces upward and the pubis medially and the acetabulum laterally. Now talking about the ossification, it has 3 primary centers and 5 secondary centers. Hope you all understood the basic concepts of the hip bone. Thank you.